Hey guys, how are you? Good to see you this morning. Hope y'all had a good evening. Today we're going to be going over chapter 7. So today is over surface disinfection and treatment room preparation. So when a patient comes in, we seat them in the chair, uh, and when we seat them in the chair, everything is going to have a barrier on it. On the chair, there'll be a chair cover. On the hand pieces, which are the drills, will be barriers. On the light handles for the overhead light, there'll be barriers. All the barriers that are used in dental offices, they can either be plastic, paper, or aluminum foil. So barriers are going to go over anything that is not easily wiped down. Like a flat surface counter is easily wiped down. So thing like a keyboard to a computer, because all of the operatories are going to have computers with a keyboard. You would put tape. It can also be tape. Tape would go over the keyboard. Then when your patient leaves, you would take all the dirty barriers off of the keyboard, the overhead light. Anything that has a barrier, you would take those off, throw them away in the trash. If they had blood on them, then of course you would throw them in the biohazard, the red trash bag. So turn to page 88. So surface barriers protect surfaces that are not easily cleaned and disinfected. It prevents contamination when properly placed, is less time consuming, reduces handling and storage of chemicals, provides the patient with visible assurance of cleanliness. It says this room has been disinfected, everything is covered. They're not putting me in a dirty room. If you notice on page 89 at the bottom, those are suctions and hand pieces. Those all have a plastic barrier on them. The picture above that shows an operatory where the chair is covered. The handles to the overhead light are covered. The tray is covered. So everything is covered with barriers. Whenever you take the barriers off after the patient leaves, the dirty barriers, you are going to do what's called pre-cleaning and disinfecting. Basically, you're wiping down a room twice. So spray everything down with disinfectant spray and get your disinfectant wipes and wipe everything down. Even though there's like the cover on the chair, I still wipe the chair down after I take off the barriers. When I take off the barriers on the handles for the overhead light, I still wipe those off. I know they had barriers. I still just like to do it. So I wipe down everything and then I get new disinfectant wipes and I wipe down everything again to disinfect. Now on state board, it will ask you when disinfecting a room, what gloves are to be worn. And they're called utility gloves. Utility gloves are the gloves that you would use, like if you're washing dishes, those rubber gloves. I call them palmolive gloves, but what you wash dishes with, those are called utility gloves. In the real world, you're just going to use latex or exam gloves. Um, but on state board, utility gloves. And I actually gave you a few latex gloves in your little take-home bag that y'all got the first day of school, or when y'all came to get your stuff for the first day of school. So pre-cleaning means to clean before disinfecting. All contaminated surface must be pre-cleaned before they can be disinfected. Why we do this is to reduce the number of microbes and remove the blood or saliva that might be on the contaminated areas. Disinfection. Disinfection is intended to kill disease-producing microorganisms that remain on the surface after pre-cleaning. Spores are not killed during disinfection procedures. Sterilization is the process during which all forms of life are destroyed. Remember I said you can't just be a little pregnant. It can't just be a little sterile. So, the term disinfectant is used for chemicals that are applied to immediate surface, such as countertops, dental equipment. The term antiseptic is used for agents that are applied to living tissues. An antiseptic would be alcohol, rubbing alcohol. There are different levels of disinfectants. All disinfectants are registered and regulated through the EPA, Environmental Protection Agency. There are 3 different levels of disinfectants that you would use. So turn to page 90 at the very top, table 7/2. There's high level disinfectant, intermediate level disinfectant, and low level disinfectant. Your high level disinfectant, it could be bleach, but nobody uses bleach to disinfect a room. Number one, it's really smelly. It smells really strong. Number two, it can bleach our clothes. Hey, scrubs are not cheap. And we don't want to bleach our patients' clothes either. So we don't use bleach to disinfect a room. And there's also a high level disinfectant called Glutra. Guys, I've been doing this 25 years. I don't pronounce it right. Glutrahalide. Here in a minute, on page 92, you can look at the word and try to say it yourself. But I've always called it glutrahalide. But we use that for cold sterile. It's a liquid sterilant that we use for plastic instruments. So, because if we put them in the autoclave that is like an oven, anything plastic would melt in there. So we use the glutrahalide to put our plastic instruments in. But you could use it as a high level disinfectant to disinfect the room. But again, it smells really, really strong. So we don't. What we use are intermediate level disinfectants. Hospital level disinfectants is what it is referred to. Lysol is a hospital level disinfectant. If you notice, there's wipes. Those are disinfectant wipes. Those are hospital level disinfectants. Next to it, Biorex and the spray. The spray are intermediate level disinfectants, hospital disinfectants. They have the active in, they can kill TB. TB is airborne. It's highly, highly contagious. So hospital disinfectants with TB activity. Types of chemical disinfectants. So you have your 3 levels, your high, your uh, hospital, intermediate level. Oh, and your low level would be soap and water. Low level. Um, so, but your types of chemical disinfectants, endorphers, they are EPA registered immediate level hospital disinfectants with TB action. Endorphers have iodine in them. Iodine, it's like a brown, reddish brown tint. Have y'all ever watched like a surgical show? And they're about to do surgery and they squirt brown stuff on the skin and then they cut them open. That has iodine. Um, my grandmother used to have what's called monkey blood. It was an antiseptic, and you rubbed it on the skin if you had a scratch. That's what is in the endorphers. And so the endorpher disinfectant, when you wipe down a chair that was beige, over time it would turn it a brown color. So not many offices like to use that type of disinfectant with the endorphers, just because they don't want to stain their chairs and their countertops. The type that we use upstairs and most offices use are the synthetic phenol compound disinfectant. It as well is EPA registered. It has a broad spectrum activity, meaning it can kill TB, HIV. Down below, and all disinfectants, hospital level disinfectants, let me go back. All hospital level disinfectants do kill all the things that I mentioned. Have y'all ever read the back of a Lysol bottle? Read everything that thing that that thing that the Lysol bottle can kill. It does. People were posting on Facebook. It was like, says it kills COVID. So anyway, uh, read the back of the bottle, and then it even tells you how long it has to set for it to actually kill. All right, sodium hypochlorite. Guys, that is a fancy word for household bleach. Sodium hypochlorite. And we actually will talk about sodium hypochlorite here in a few weeks when we talk about root canals. So, but sodium hypochlorite is a fancy name for household bleach. Excuse me. Alcohol is an antiseptic that you can rub on your skin. Also, too, little known fact, mouth mirrors that go in the mouth that the dentist can look at the teeth. If you rub alcohol on the mirror, it stops it from fogging from the patient's breath, hot breath, how it can fog something up. You can rub a little bit of alcohol on the mouth mirror and it stops the fogging. Little known dental tip. All right. Let's turn the page. Page 92. There's that wonderful word that I never can pronounce. Glutralide. Glutralide. That one. It's classified as a high-level disinfectant, but it also is used as a liquid sterilant. Your cold sterile. Glutralide comes in a jug. You would get a plastic container for the liquid in there, and then anything that was plastic and plastic instruments that you used on the patient, we would drop in that liquid, and it sits from 6 to 8 hours, and that's known as a sterilant for it to be 6 to 8 hours. Cold sterile, the liquid itself gets dumped once a month, every 28 days. Every 28 days, new liquid is replaced into the plastic container. But every morning, the plastic instruments that have been sitting all day and all night, you have to take those out, because if somebody drops another instrument in there after the 8 hours, it reactivates the time all over again. And there's a lot of times that whatever's in cold sterile, that plastic instrument, you're going to need that day. So that's why I always make sure that you empty the contents of what's in the cold sterile every morning. And guys, you're like, what is she talking about? I mean, I kind of understand. When we start clinic, that very first day, I'm going to go over sterilization with you. How to start the autoclave, how to change cold sterile, all this fun stuff that I'm going to talk about today and tomorrow for chapter 8. It's all about sterilization, and believe me, you're going to touch it, feel it, know it. Because sterilization is something that we do from the minute we walk into the dental office in the morning till the minute we leave at the end of the day. It's an all-day process. We are constantly turning over instruments, sterilizing instruments all day long. So you will get very familiar with every process and what it's used for: cold sterile, disinfectant wipes. So I mentioned before the autoclave. It's like an oven. The autoclave is our sterilizer. So any instruments that have cut through the gum tissue, surgical instruments that were used to extract teeth or do any type of surgery, those types of instruments are known as critical instruments. And those would go definitely into the autoclave, the sterilizer. Then you have semi-critical instruments. Those instruments would be anything that goes in the mouth that touches saliva, blood. Those as well would go into the sterilizer. And your non-critical instruments are instruments that never go in the mouth. I don't know if y'all have ever gone to the dentist and had x-rays done, and they put that heavy apron on you, the lead apron. You just wipe that down with disinfectant wipes. That's considered a non-critical instrument because, of course, we're not putting that in our mouth. So, oh, give me 1 second. Hold on real quick. Hold on, guys. Hold on. I have to sneeze. Boo. Look, I'm bugging. Oh, I'm so silly. I know it. Okay. Uh, I just I got these this weekend, and I've been dying to do that with y'all. I thought today would be a fun day. Okay. Um, where was that? Page 93. So again, you can see critical, semi-critical, non-critical. Critical, touch bone, penetrate soft tissue, and risk of disease transmission very high. And of course, it's the procedure to clean those instruments are sterilization. Your semi-critical instruments touch the mucosa, which is the lining of the mouth, but and saliva and blood, but they won't cut through bone or tissue. Those are semi-critical instruments. They are sterilized as well. And then you have the non-critical again, like a lead apron, anything that doesn't go in the mouth. You just disinfect. Okay. So down below, try not to touch anything if you don't have to, because we don't want to cross-contaminate. So if you were in the patient's mouth and you had your gloves on, don't go dig in a drawer if you don't have to. So that's why it's so important to make sure that when you set your room up for your procedure with your doctor, that everything that you're going to need for that procedure is ready to go. That way you're not cross contaminating because you forgot something and you're like, oh, let me get this. If you do have to, because it's going to happen, you'll forget something. Take your gloves off, go get it, put new gloves back on. Okay. All right. Your suction, Mr. Suction, is going to help you when you're suctioning your patient's mouth. It's going to really help you and the patient cut down on all the droplet infection, the spraying, the splatter, the splash, the aerosol, wet aerosol coming out of the mouth. So your oh wait, that's not my suction. Sorry. Uh, your large suction is going to suck up a lot of that aerosol that's coming from the mouth. My computer came unplugged. Um, and again, make sure you have all your PPE on, personal protective equipment, your face shield, your safety glasses, your mask. Rubber dam. I'm going to show you what a rubber dam looks like. This is a rubber dam, okay? It's made out of latex and stretches. It goes over the mouth, and this is called a rubber dam clamp. And only the tooth that they're working on would be exposed. So the tooth would stick out of the clamp. And that way, it helps prevent any of the splash or splatter, the aerosol, the droplet infection. Most of the time, though, this is typically used for root canals. We used to tell little kids this was a raincoat for their tooth. Thank you. All right. So, pre-procedure mouth rinse. We have the patient rinse with Listerine before we start a procedure, and it helps cut down on the bacteria in the mouth. That's what a pre-procedure mouth rinse is a rinse with Listerine. Using disposables. That section I showed you, the large section I showed you a minute ago, the white, that's disposable. That goes in the trash. It doesn't get sterilized. Um, there's also a small section. This is Mr. Thirsty to kids. This is your small section. This is only going to suck up spit and saliva. This is disposable. It just goes in the trash. Most of the time, when you are dealing with patients during a procedure, there might be some blood. So if you do have blood, then that would go in the biohazard trash, not regular trash. Dental water line contamination. So as water stands in narrow dental unit water lines, some of the bacteria attaches and accumulates on the inside walls of the lines, forming a biofilm. Biofilm is like that slimy, nasty stuff on rocks. Well, it can accumulate on the inside walls of the water lines. So every operatory and every office will have a separate water reservoir. It's a water jug, and you fill it up with distilled water, and we put a tablet. You can put Listerine, anything that's going to help kill the bacteria that's going to be that would accumulate in the water lines. So every office, every operatory will have the individual water reservoirs. And of course, in clinic, I will show you those. You'll learn how to put them on, take them off of the of the of the unit. But what it does is it helps to cut down on the biofilm that would accumulate in the water lines. On Monday mornings, I always flush my water lines before I use them on patients just to be safe. So, like the drill, I'll flush a little water through the drill. The air water syringe, it's a syringe that we rinse the patient's mouth with. I always squirt a little water just to flush out the lines from what was sitting over the weekend. Anytime we take an impression on a patient, we always need to spray it. Well, first you'll rinse it, and you will want to rinse it. Sometimes there's leftover Cheetos in there. So rinse with water, in the sink, rinse your impression off, and then you're going to spray it with disinfectant spray. So because the impression can be contaminated with their saliva and blood. So always disinfect your impressions. Disinfection of other materials. I'm on page 95. All brushes, rag wheels, and other laboratory tools should be sterilized or disinfected between each patient. between each patient. So, again, when we get into clinic, I will show you the lab and what a rag wheel is. It's a wheel and it's made up of rags, like what you would, I don't know, rags, dish rags, but different. I'll show you. I'll show you in clinic. Okay. All right, guys. Well, that completes chapter 7. So I hope y'all have a good night. And don't forget chapter 7 book, workbook for homework, and take your test on Evolve. Also, a little trivia question. What was I wearing yesterday on the video that was kind of out of place? That it was like, I wonder why she's wearing that. So, anyway, and uh, so yeah, uh, shoot me a text on Remind and tell me what I was wearing that seemed a little out of place, and also tell me where was I. All right. Okay, guys. All righty. Well, that ends our lecture for today. I will see y'all tomorrow. Peace.